Hello, everyone. Thank you for joining us. We're going to start in a few minutes. We're waiting for everybody to come in the webinar. They're just joining. Okay. Okay, well, good afternoon. Welcome to the webinar, A4A's HIV Medicine Recycling Program. My name is Luis Mares. I am the Director of Community Mobilization at the Latino Commission AIDS. And I'm here to open the webinar and moderate with the staff of A4A in collaboration with the Latino Commission AIDS. We know that today there is over 37 million people living with HIV around the world, and over 40% of these people lack access to treatment. A4A has been working since 1999 with a medicine recycling program that has been a pioneering and essential program that collects and uses unexpired HIV medicine in the United States to recycle and distribute to people with HIV in the developing world with no access to treatment. The COVID-19 pandemic has made this a little more difficult, and this is why we're bringing you the information. Today, A4A staff is here with us to tell us about the importance of medicine recycling and the process behind it. Before going ahead with the webinar, a little bit of housekeeping. This webinar is being recorded. So whoever is on the phone, please mute your mix if you're not speaking. And the presentation and the recording will be shared with everybody after the webinar. I ask you to use the question and answer box, Q&A box, to write your questions to the presenters. Today, we have three wonderful people that work for A4AIDS, helping everybody around the world. We have Jaime Valencia, Ariad Rosales, and Leonardo Clint. Jaime Valencia is the Director of Programs and Medical Director for A4AIDS International, an organization that he has been part of since 1999. Prior to coming to New York City, Jaime earned degrees in medicine and surgery from the Catholic University of Cuenca at the State University of Guayaquil in Ecuador. Before coming to A4AIDS, he was working as a primary care physician at the Santa Clara Medical Center in Cali, Colombia. He also spent several years working as an emergency room physician in the clinic of Santiago de Cali, as well as working in private practice in Guayaquil, Ecuador. He has presented at several international conferences around the globe on the effectiveness of drug redistribution programs and issues in treatment of adherence for people with HIV in Latin America and the Caribbean. As Director of Programs, where he oversees and coordinates satellite offices located in New York and 5 different countries in Latin America and the Caribbean. Ariadne Rosales graduated with a bachelor's degree in corporate communications and marketing. Before joining A4AIDS as communication manager in August 2019, she worked in public relations and represented various brands within the lifestyle industry. And finally, Leonardo Clint is the coordinator of the HIV Medication Recycling Program for A4AIDS since 2004. He studied pharmacy technician at La Guardia Community College in 2014. Before coming to New York City, he studied systems engineer at the University of Santiago Marino, Caracas, Venezuela. As coordinator of the HIV Medicine Recycling Program, he is responsible of enrolling, shipping medicines, and following up with the beneficiaries in our Access to Treatment program once they are approved. He coordinates with the satellite offices and the beneficiaries, as well as updates their info through their database. He, along with his team members, coordinates the reception, classification, storage, and shipping of medicines donated from different donors. He maintains a direct communication with the beneficiaries' doctors in those countries where A4A satellite offices are not available to evaluate the different options in treatment available in A4A. So with this, I think Ariadne is going to start. You can start sharing your screen.
Hi, everyone. Thank you so much for joining us. Thank you, Luis and Latino Commission, for having us here. I'm going to start sharing the presentation. Okay. So as Luis said already, we're going to be talking about our very own HIV medicine recycling program and how it works. And well, of course, we want you to learn how it works so that you can join us either by donating your surplus medication or helping us to spread the word about what we're doing. 848 operates the largest HIV medicine recycling program in the world. Since 1996, which is when 848 was founded, and it was actually founded thanks to this program. We started with this program, the HIV medicine recycling. So it's very special for the organization. And since 1996, we have recycled, collected, and recycled and redistributed over $160 million in medicine. Throughout the years, over 20,000 people have received those medications. So they have been able to access HIV treatment thanks to the medication that we've recycled. And these people are located around 59 countries across the world. So this is definitely a program that has a lot of impact. What is medicine recycling and how it works? Medicine recycling consists on recovering unused and unexpired life-saving medication that otherwise would be wasted. So it's basically using surplus medication of people who are changing treatment or changing their medication, or who simply cannot take the same medication anymore. And instead of throwing it away or burning it or just letting it go to waste, we use that medication and redistribute it to people who otherwise would not have access to it in the developing world. One of the main doubts regarding medicine recycling is its legality. So there are no legal impediments to collecting used medicines in the US, and those medicines are redistributed to overseas as humanitarian aid. So we don't redistribute them inside the US, at least not yet. However, it is worth noticing that there are some cases of similar programs or of similar recycling in some states of the United States. So that is something that, of course, is in the works. The objective or the goal of this program is to reach people with HIV who may have surplus medication they no longer need and can be recycled. Why donating? Well, as Lisa stated when he welcomed us to the webinar, more than 37 million people are living with HIV around the world, and over 40% still lack access to treatment. Some of the beneficiaries of this program who receive our recycled medication live in places like Egypt or Honduras, Belize, and some countries where healthcare is just not accessible, some countries where HIV remains a very stigmatized health condition, and these people will otherwise not have access to treatment, not only because their healthcare doesn't cover it or because of the of government of government obstacles, but also because of the stigmatization and fear of letting other people know that they have HIV. The process. So how does this program work? First, we collect HIV medicine donations. We have several ways of collecting them. So throughout the years, we have developed partnerships with local community-based organizations, HIV clinics, and other facilities that have allowed us to implement or to put drop-off boxes in their locations. So this allows people who usually visit these community-based organizations or these clinics or any of these facilities with drop-off boxes to simply drop their meds in this box. Then our HIV Medicine Recycling Program team, picks up those drop-off boxes. We process the medication in our office and put the drop-off box back in the location. So it's kind of like like the mailbox that you have outside of your home, where you simply put things that are picked up by somebody else and relocated where they should go. Another way of collecting medicines is through direct shipping. So, of course, we do not have many drop-off locations across the United States. Most of our locations are based in New York or New York City. So for people who do not have a drop-off location near them, or who simply cannot attend to the drop-off location, we offer direct shipping. People can simply ship their medicines to our office, to our headquarters in New York. And for people who cannot cover the shipping costs, we offer to cover the shipping fees and send them prepaid FedEx shipping labels. So this is the way that we collect medication. So then the next step in the process is recycling them. So we gather, sort, and discard the unused and unexpired medicines, including antiretrovirals and any other medicines that may benefit people with HIV. We store them in our office and can continuously gather and redistribute it according to the needs of our beneficiaries. And then with the redistribution of medicines and nations, we formally enroll people with HIV in the developing world into our Access to Treatment program, and we remain in contact with the beneficiaries and their healthcare providers. So this is something that Jaime will explain a little bit further, this step about the Access to Treatment program and the enrolling process of people who want to access to this recycled medicine. So it's basically a three-step process that starts with us collecting the medicine, and then the medicine going to our beneficiaries who enroll through the Access to Treatment program. So the recycling program collects the medicines, and then we redistribute it through this Access to Treatment program. So Jaime, you can share some of the information on this with us.
Thank you very much, Ariane. And thank you very much, everyone, just for listening and being interested in our program. Then, following Ariadne, what kind of medication do we need or we collect? Definitely, we need all kinds of antiretroviral medications, from protease inhibitors like reverse transcriptase inhibitors, entry inhibitors, integrase inhibitors, all kinds of antiretroviral medication from all the families. And other medication just related with the treatment for people with HIV, like treatment for comorbidities, like diabetes, hypertension, cardiovascular diseases, elevated cholesterol, also some kind of infections like hepatitis C, or for opportunistic infections, or for prophylactic like antimycotics, antibiotics, etc. Go the next, Ariadne. Then we have the access to treatment. This access to treatment is almost the third phase of Ariane explained before, is the redistribution program. Here we ask all the applicants to fill an application app. It's an application app from A4AIDS. Here we collect all kind of information, from demographic information for the client, like names, age, contact information, address. Also, we collect a clinical background of the beneficiary client. We ask for the healthcare provider contact information. Also, the beneficiary needs to send, besides the application form, all the test results, copy of the test results, like HIV tests or scores, and copy of the CD4 count, copy of the viral load, and also copy of their prescription. Once we have all this information collected, and before we enroll this person or the client into the program, we need to be sure that we have at least 6 months supply of the medication that the doctor is asking for. This is just for us to guarantee the continuity of the treatment for this beneficiary. The next one, Ariadne. Then once the client is enrolled, we closely monitors all our clients just to guarantee that all, of course, they receive the medication, that they remain in treatment, and they comply with all the program's terms and conditions. Also, we follow all our clients and about adherence counseling or treatment education if needed. Also, we ask them just to send us at least once a year or twice a year a medical report and copy the CD4 count and the viral load. Just for us to be able not only just be sure that the client is doing well with the treatment that we are provided, but also we need to be sure that this medication is not going into the blood market. I think next one is about shipping, and I think Ariadne, I pass this over to you again.
Yes, thank you, Jaime. So just as Jaime explained, this program has been in place for 25 years already, well, almost 25 years next year. So we thought all of the conditions that need to be in place in order to prevent the program from malfunctioning, such as from the medicines ending up on the black market. So regarding the shipping instructions, this is regarding how to send or drop off your medication. So AIDS for AIDS accepts all unexpired antiretroviral medicine, as well as medicine that may be useful to manage comorbid conditions in people with HIV, just as Jaime mentioned before. AFA will accept bottles that have been opened as long as the medicine is still unexpired. And AFA also accepts sealed containers of liquid and powder medication, both sealed and unsealed containers of sealed. Regarding the whole sealed and unsealed, which can be a bit confusing, we have here more detailed information. So how would this shipping process go? If you live in NYC, or if you first want to find out if there is any drop-off location near you so that you avoid shipping costs, the first thing to do is to head to our website, aids4aids.org/locations, or aids4aids.org in our section of GIFT, in the section of HIV Medicine Recycling. You will find a map and a list of all of the drop-off locations available. However, due to COVID-19 and of course to the social distancing measures, most of our drop-off locations remain closed. So right now we're working more on letting people know that they can send their medication directly to our office, which is in 131 Varick Street, New York. I will of course write this down in the chat so that it can stay somewhere written. So the next step after deciding whether you want to ship it or drop it off at a drop-off location is to please remove the names and addresses of all individuals from the prescription bottles or the pills in the packages in order for us to comply with privacy and confidentiality laws. But of course, please always leave the name of the medicine and the expiration date visible so that we can make sure that it's unexpired, and so that we have a way to identify with which medication it is. Then the packaging process, just as we were saying, we can recycle all used and open bottles. What we need to be mindful about is the process of packaging it. So we need all pills to be placed in a bottle, and those bottles should be placed in a plastic bag inside a padded envelope or a cardboard box. All pill bottles, of course, should be securely closed, as well as the liquid and powder medicines need to be sealed. And please do not send any loose capsules or tablets inside a plastic bag or box. So we do need the medication to be inside a bottle. Maybe putting the, like for example, putting the pills, the loose pills inside a Ziploc bag does not work. We need pills to be inside a bottle. Doesn't matter if the bottle has already been opened. We just need it to be in a bottle. So recapping, for the shipping process, we need the medication we need you to remove all of the names from the bottles and the packaging. We need you to delete the name of the medication and the expiration date visible, and to put these bottles or these medicine tablets and boxes inside a plastic bag, and that plastic bag inside a padded envelope or a cardboard box. Please avoid sending any loose tablets or capsules. And then the last step is, once you're ready to ship, we ask you to please fill out the donor card, which is available in our website as well, in the medicine recycling section. And so we just need the donor card so that we can better keep track of the medications that we've been getting, and for, of course, data and information monitoring. So if you would like to keep your donation anonymous, we just need you to please fill out the rest of the information regarding the donation. And of course, this donor card will also allow us to send you a thank you note and send you a confirmation of your donation, which, if you want to use it for tax deduction or any other for any other use you have for it. And at last, regarding this program, we also have something called the Medical Ambassador Program, which is basically you becoming our ally. So we have two ways to help or to partner with us for the HIV Medicine Recycling Program. You can either donate your surplus medication, or you can help us promote from spread the word and let people know that they can donate their surplus medication. So AFA's Medical Ambassador Program works with healthcare providers who help us promote the medicine recycling program in their center and or with patients. And we can provide, of course, all promotional materials such as brochures, posters, teams, whatever you name it that you think could be helpful for you to promote our program. We can provide you with it. And then we can simply schedule, either you can collect your medication or tell people where to ship it, tell people where to drop it off. We can, of course, work out all of these details once we enter in an agreement. And so this is the Medical Ambassador Program. As I was telling you before, one of the first steps we tell people to follow when wanting to donate their medication is to first find out if they have a drop-off location near them. So here is the information you will see in the website, 848.org/ locations, drop-off points in New York. And also, if you want to ship it directly to us, our address is 131 Varick Street, New York, New York, zip code 10013. You can also, of course, follow us on social media at 848 on Instagram, 848 International on Facebook, and keep in touch with us, DM us any questions that you have. And this way you can also keep track of any new drop-off locations, tag us in whatever post you want to promote, or let people know about what we're doing. We would be tremendously thankful for that, because, well, as I stated before, and as we've shared, the COVID-19 pandemic and the closure of our regular drop-off locations has tremendously hurt the program and medicine donations. They have fallen between 60. Of course, this will affect our beneficiaries who depend, many of them depend on our medicine recycling for them to get access to treatment. So, well, we have some questions. I can see them here. And we have Leonardo here, who works directly with the program in the enrolling process, in the recycling, in the sorting. And he will be glad to answer your questions. Let me just, oh, yeah,
Okay.
I had lost them. Okay, so I think we have here, okay, I see unexpired meds are not allowed. Okay, so Tammy asked, yes, unexpired meds are allowed. And meds that are open but not expired, yes, they are allowed. As explained before, you can send the medication even if it's as long as it's unexpired and open. You can just place it. So please keep the pills inside the bottle and place them inside a cardboard box. Shannon is telling us she would like more information on becoming a drop-off location in Central Florida. That would be amazing. Thank you so much, Shannon. We can let me let you know where you can contact us via email. You can email me directly and Leo as well. And we can coordinate on how the drop-off location goes. Queen Ezekalu, I'm hoping I'm pronouncing your name well. Quinn, any pickup locations in West Africa? Leo, do we have any pickup locations in West Africa?
Yes, we do have some location in Africa and Nigeria to be more specific. Thank you.
Great. So on those pickup locations, where would they be available, Leo? Do we have them available on the website, or should people interested in picking up donations in Africa simply email you directly?
Okay, all the medication that going, sorry, can you repeat again the question?
Yes, I think they were asking about pickup locations in West Africa.
Nigeria, to be more specific.
Your email, and she can contact you on email on whatever they need.
Sure. If they need more information about where in which location we have donated some different kind of medication, you can email me at lclyde@848.org.
Yes, great. Thank you. Do we recycle the used pill bottles?
Can you hear you?
Do we recycle the used pill bottles? This is something that Schiller Wardlow is asking us. Do we recycle the used pill bottles?
I cannot hear you very well.
Oh, okay. I'm sorry. Let me just. Oh, okay. So we do recycle the used pill bottles, but we send them to the beneficiaries. So we send the bottles with the pills inside them. Tammy is asking me, we accept medicine bottles with labels taken off. Yes, we accept them with the labels taken off, but we need to know what's inside, like what's the medication and what's the expiration date, right, Leo?
Yeah, we're gonna talk about just a little bit from the medicine that we receive. Okay, as you said, all the medication must be identified with the name of the medication plus the expiration date. Also, in case you, the donor, do not remove the label on his name on the bottle, we're going to do that for confidentiality reasons. We can take also medication open and sealed back, no expired.
Great, thank you, Leo. And okay, another question we have is, can any pharmacy install a box for medication drop-off?
Yes, one of the pharmacies is located in Georgia, Atlanta. It's named Alliance for Community Pharmacy.
Great. So yes, so Lorenzo, if you are interested in having a drop-off box in your pharmacy, if you work at a pharmacy, we are most definitely interested in having a drop-off box at any pharmacy. We're interested in having a drop-off box anywhere they want to have one. So email us at arosales@848. Yes, okay, I'm having your email here. I will actually email you.
Of course.
Thank you so much. And I am also answering to Lucero, who's asking, how would we access the shipping labels and donor cards? So email us at LCA, and also in our website, in the medicine recycling section, you will find all of the information regarding donor cards and the process. So it's 8for8.org. What we do, HIV Medicine Recycling.
Second program.
Yes. And I don't see any more questions. I can check the chat as well. I am seeing some people. Okay, any drop-off locations in Florida? Mary, do we have any drop-off locations in Florida right now, Leo?
Leo, at this time, we do not have
No, we don't.
any drop-off boxes.
I also privately answered to Mary while we were doing the presentation. We recently spoke to some community-based organizations such as Trans Social. We're working on having a drop-off location there. However, we don't. I mean, that's not yet happening.
But we have some ambassadors in Florida that maybe Leo can share with the person asking this question. That they collect the medication down there and they send us to New York directly.
Yes, exactly. We have some medical ambassadors. You can, if you're interested in sending medications from Florida, you can either contact our medical ambassadors or simply ship your medication to us. Contact us for if you want or need a shipping label. And well, some of our ambassadors are, for example, this Trans Social organization. They're based in Florida. And if you're interested in having a drop-off box in Florida, of course, we're also very much excited and open to it. So thank you, Mary, for asking. Leo, here's another question. They are asking, any restrictions on 3340B or ADAP meds?
No, the restriction for recession medication basically is we do not take narcotics, no controlled substance. And regarding the ADA program, assume the ADA has the relation with the pharmacy that is the only one supposed to provide the medication to the donors, to the patient. There is no more relation between ADA and the pharmacy because the patient already received. We asking the patient about the medication that he don't going to use it. I mean, the patient is not going to return the medication to the pharmacy. He can donate it. We are talking about that kind of medication.
Great. So exactly. So even if they have medications from the ADAP program, they can still donate it as long as they use it. As long as if they cannot use it anymore, right?
Oh, exactly.
Right.
Great. So, yes, so I see some people asking, will this PowerPoint be accessible? Yes, as we said before, it will be accessible. List drop-off locations in New Jersey, 8for8.org/locations. Okay, Leo, can we share some of the countries enrolled in West Africa? I know you already said Nigeria, and I'm not sure if you said some more.
No, so far we do have, we provide some medication and still provide medication to Nigeria, but in the past we have some medication to another place that I don't have in mind at this time, I'm sorry, but I would like to share with you because some of those kind of countries is like Congo and also Burundi. We have been providing some additional information regarding the recycling program as well.
Yes. Okay, someone else asked, I'm sorry if this was covered earlier. The program only pertains to unused and open medication. No, it's unused and unexpired, but they can be open. We just need it to be unused and unexpired. Do we have a presentation in Spanish? We do. Cruz, please email me and I can send you some of our Spanish materials. Do we deliver meds to PR? Leo, do we deliver meds to PR? I think we do, right?
Yes.
Okay.
Slide $8
Exactly. And I think we have some more questions on the question box. Can someone from the USA use this program?
I've been in the program for the past 17 years.
Ariane, the program is all the medication that we collect, we send it abroad.
Thank you.
Yes, sometimes we have been helping people in United States, but this is just like a specific or maybe a special beneficiary that really lacks of the treatment, and he's not going to get it. But the program is designed for people in developing countries abroad the United States.
Yes, great. Thank you, Jaime and Leo. I think, yes, so someone's commenting, essentially this is a global relief effort. It is. So I think, yes, I think we have no further questions, or if anyone else has. Okay.
I think you have a question though.
Sorry.
No more questions.
Okay.
Okay, I think you answered everything, and thank you very much for this presentation. This important information about the job that you guys do, helping so many people around the world. That's an amazing thing you've been doing for so many years, and I wish you will continue doing this with the help of everybody. It looks like many people who is attending the webinar is very interested in helping you from different parts of the country and becoming ambassadors and becoming places where they can drop medications. I hope everything goes well.
Thank you.
Yes, thank you everyone for listening. Just you are able just to collect medication or spread this information. It will be great because of the COVID-19. The medication that we have been collecting has decreased at least like a 50%, and the demand in developing countries is getting worse. For example, now, especially with the Venezuela humanitarian crisis, that is getting worse in Venezuela, the medication is more needed right now. Then we are really need a place for antiretroviral medication. Then any help that you guys can just provide to us, it really will help us.
Great.
And as additional note, I would like to share with all of you, if they are interested, to receive some additional information regarding promotional material A4AIDS. We'll be more than happy to share with you. Just email to Ariane Rosales or to me or Jaime, either one. We're more than happy to share the information with any of you.
Yes.
Thank
you so much once more, and thank you so much, Luis and Latina Commission. We're tremendously excited and thankful for the opportunity to share what we're doing and to have 100 participants today learning about this, and of course establishing new partnerships and getting people to spread the word, and just know that literally everything we have can help in something. Either if it's your unused medication, your surplus medication, or letting people know that they can do this. We can all help each other. Thank you.
Thank you. Thank you again for the job you do. And thank you everybody for joining us today. Don't forget to go to a4aids.org where you can get more information about this. And have a good night.
Bye.
Thank you.